Homeostasis or normal blood glucose levels are around 90 milligrams over 100 milliliters. A person's blood glucose level can rise for a variety of reasons. One, for example, is eating. After eating, especially food that contains lots of sugar, your blood glucose levels rise. Next, your pancreas gets involved, specifically the beta cells, which are signaled by high glucose levels to produce insulin. To help lower your body's glucose levels, insulin does two things. It allows the body cells to take up glucose as energy and allows the liver to store glucose as glycogen. As blood glucose levels drop, insulin stops being produced, bringing your blood glucose levels back down to homeostasis. There are also many reasons as to why a person's glucose levels may lower beyond normal. A common reason is due to skipping a meal. After a decrease in blood glucose levels, the pancreas is once again involved, but this time the alpha cells are signaled to create glucagon. Glucagon allows the liver to break down glycogen it stores back into glucose. This glucose is then sent back into the bloodstream. As the glucose levels rise, the glucagon levels lower, bringing the blood glucose levels back down to homeostasis.
As we have discussed, insulin is what allows us to take up glucose and use it as energy. We will now see how that is done. Upon ingesting glucose, it circulates into the bloodstream. In a healthy person, the beta cells are signaled to produce insulin. Insulin then fills the insulin receptors on a cell. This signals the nucleus to produce GLUT4 channels on the cell. These channels are what let glucose enter the cells, since glucose is now given a place to go.
Some similarities among type 1 and type 2 diabetes are high blood glucose, similar symptoms such as frequent thirst and urination, and in both cases, insulin is affected. In type 1 diabetes, the beta cells are damaged, leading to very little or no insulin being produced. People who have type 1 usually experience an early onset in their teenage years. It is passed down through genes and can be treated with insulin. In type 2 diabetes, many experience too much insulin being produced. This can lead to insulin resistance, which basically makes a person's insulin receptors worn out. Lucky for people with type 2, it can be managed through lifestyle. For example, exercising frequently and eating healthy can help to diminish many of the symptoms. People with type 2 diabetes usually get diagnosed in their 40s.
In a healthy person, after eating, their blood glucose levels will rise. However, insulin will be produced and lower their glucose levels back down to homeostasis. In a type 1 diabetic, after eating, their glucose levels may be above normal, but if not, they may still have diabetes. To know for sure, we have to see if their blood glucose levels eventually come back down to normal. And in a type 1 diabetic, this will not happen. This is because little to no insulin is produced. In a type 2 diabetic, after eating, their blood glucose levels will most likely be above average. But if not, we can not outrule the possibility of diabetes for reasons we have previously discussed. A person with type 2 diabetes will produce insulin, but their glucose levels will not decrease because it either does not fit in the receptors or does not send a signal to the nucleus to produce a GLUT4 channel. As shown in the graph, Anna has almost no insulin being produced. Since her glucose levels have risen and not come back down to normal, we know she has diabetes. And since she is not producing enough insulin, we know she is a type 1 diabetic.
As shown in our illustration, a person with type 1 diabetes will not produce enough insulin to lower blood glucose levels. A person with type 2 will either produce insulin that does not fit or insulin that does not send a signal to the nucleus to produce GLUT4 channels, stopping glucose from entering the cell.
Hyperglycemia is when there is too much glucose in the blood. This causes water to leave the cell in order to dilute the high glucose concentration. Hypoglycemia is when there is too little glucose inside the bloodstream. This causes water to move into the cell in order to dilute the high glucose concentration. In a normal blood glucose level, there are an equal amount of glucose molecules in the bloodstream and in the cell.
Frequent thirst and urination are two of the most common symptoms for those with diabetes. This is because due to hyperglycemia, the kidneys are not able to reabsorb all of the glucose. This forces them to work overtime, possibly leading to damage. Since all glucose is not reabsorbed, it is released through urination. Since water follows glucose, you lose lots of fluids and become dehydrated. Even if you drink more water, it will go straight into your urine, creating a negative feedback loop. This is a short-term symptom, seeing as how by giving a diabetic insulin, The glucose will be able to be absorbed by the cells and the liver.
Neuropathy, caused by high blood glucose levels, injure nerve fibers throughout your body and can result in damaged nerves in your legs and feet. Depending on the affected nerves, symptoms range from pain to problems with digestive system, urinary tract, blood vessels, and the heart. This is caused by hyperglycemia and is a long-term symptom.
People with diabetes may experience nephropathy. The kidneys have many tiny blood vessels that filter waste from your blood. High blood glucose from diabetes can destroy these blood vessels. Over time, the kidney isn't able to do its job as well. Later, it may stop working altogether. This is called kidney failure. This is caused by hyperglycemia and is a long-term symptom.
People with diabetes can have an eye disease called diabetic retinopathy. This is caused by high blood glucose levels, which cause damage to blood vessels in the retina. These blood vessels can swell and leak, or they can close, stopping blood from passing through. Sometimes abnormal new blood vessels grow on the retina. All of these changes can lead to a person going blind. This is caused by hyperglycemia and is a long-term symptom.
People with diabetes may experience weight loss. This is because insufficient insulin prevents the body from getting glucose from the bloodstream into the body cells to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. This is caused by hypoglycemia and is a short-term symptom.